Welcome to the Sniff Spotlight series. I'm your host, Yitz Rubin, and in this series, we will be speaking to some of the healthcare leaders who are making a big impact in the industry. Join us as we shed light on a variety of topics that will benefit both our Sniff colleagues as well as the general public. Welcome to the Sniff Spotlight series. Today we have this privilege of speaking with Jenny Spencer. She is an oncology nurse, a certified personal trainer, and the founder of Phytofatigue. So thank you so much for coming on. Can you tell us about the importance of exercise?
My background is in oncology nursing. I'm from the Chicagoland area. I've been an oncology nurse for the past 10 years. The experiences that I've had with the oncology population has led me to start up Phytofatigue, where I provide exercise programming services to the cancer population in order to improve their, most importantly, quality of life and to help address cancer-related fatigue. Being in oncology nursing, you witness a lot of common symptoms and side effects throughout the cancer populations, regardless of cancer diagnosis or treatment, and energy and deconditioning, which is loss of physical functioning, seems to be two of the main, most common side effects that are experienced. And we're not really doing a ton to address it. It's not as easy as addressing something like nausea, where you can give an anti-nausea medication and it can improve within an hour. It's something that takes a little bit more time and commitment. And evidence-based research has actually shown that exercise is the best intervention to address both of those side effects.
How does exercise affect both the body and the brain?
Specifically, because my research is really mainly in the oncology field, there's a side effect called cancer-related fatigue. And cancer-related fatigue is a multi-component syndrome that affects your physical, your mental, and your emotional health and well-being. Exercise has the ability to pinpoint both or all three of those components. Physically, when you're doing an exercise program, you can increase your muscular strength and endurance, your cardiovascular endurance, flexibility, your mind and body vitality. Emotionally, exercise has been shown to help better regulate your mood, deal with stress better, and also has that feel-good component to it. Along with that, it also leaves one with the ability that they are more proficient in doing activities during the day, so it can help with self-efficacy, independence, and self-esteem. Cognitively wise, even after just one bout of exercise, research has shown that it helps release this neurotrophic factor in your mind and brain that helps promote better cognitive functioning. And then when you're continuously doing physical activity, it has been shown that that population has higher levels of that neurotrophic factor going on. So it just helps with cognitive functioning.
What are some exercises that are both easy and effective for anyone to do, including myself?
Really, everyone is different and their bodies are different. So certain exercises some people maybe shouldn't do, and certain exercises people should definitely do. So you should always consult with your physician or an exercise professional or your physical therapist to make sure what you're doing is the right thing for you to be doing. Focusing on the 5 functional movements in an exercise program is usually sufficient in helping you gain strength and endurance. So that is the bend and lift movement. It's a single leg movement, push movement, pull movement, and a rotational movement. And if you wanted to do some with me, yes, we can demonstrate some now. So we are going to start with the bend and lift movement, which is essentially a squat. So a lot of times in the elder population, chair sit to stands are a great exercise to use. So you'll have a chair with you for support. You are going to have your feet about hip width apart, bend your knees slightly. You're gonna bring your hips back first, like you're trying to sit over the chair, and then you're gonna go down, and you can either tap the chair or you can sit completely, and then push through your feet, come back up to standing. Perfect. And then we're gonna do it again. So remember, bend your knees, push your hips back first, then sit down, then push through your feet, mainly your heel. Perfect. Come back up to standing. You could squeeze your glutes at the top. Let's do 2 more. No. Another good one to use. So single leg movements are really something you do all throughout the day because it's your walking, jogging, biking, lots of things, lots of movements. A way to train those muscles that help you perform those movements is something called leg abduction. So we are going to have a chair in front of us for support if you feel like you don't need support. So you're going to transfer your weight into your standing leg, and you're just going to bring your leg out to the side. Really focus on keeping your hips pointed forward. Good. Okay, so if you have canned goods in the house, you can use those for weights. You also don't have to use weights, or you can use free weights as well. But this can be performed sitting in a chair. You're going to sit back a bit, and we're going to do one of those push movements. So we're pushing the cans forward in front of us. Good. Almost touching one another and releasing, coming back. And this is a chest press. So this is a chest press in the chair, working those big pec muscles. Good. And coming back.
So Jenny, would you say there's a difference between how you treat oncology patients to the general elderly population?
The main issue that you would have to think about when you're dealing with the elder or senior population, specifically in oncology, is comorbidities and how you might have to adjust certain exercises that you do. So whether it's that they also have history of diabetes or high blood pressure or other heart problems, you might have to adjust the intensity of their exercise regimen in order to help them, be safe and also effective in what they're doing. Specifically, Fight the Fatigue is geared towards those going through cancer treatment or those who are recovering from cancer treatment. Within the elder population, it's projected that like over 70% of the oncology population will be 65 and older by 2030. So it really is going to hit that population and age group. So Fight the Fatigue, the main reason why I started it was to address quality of life and physical functioning within those living with cancer. Exercise doesn't have to be thought of as we are trying to be a bodybuilder or run for a marathon or anything like that. Specifically, exercise during cancer treatment or when you're recovering from it is meant to just help you function better and live a better quality of life.
So Jenny, what does the future look like for Fight the Fatigue?
I'm hoping that it continues to grow. It's unfortunate that the pandemic happened, but it's, I think, made a lot of possibilities for certain businesses, especially for Fight the Fatigue. So I've been able to connect with patients and also the oncology care teams across the country. So hopefully it continues to grow and we can keep servicing this population so that we're able to empower them to improve their quality of life through exercise while living with cancer.
Thank you so much, Jenny, for coming on to the Sniff Spotlight. I got a great workout and I feel loose right now.
Thank you so much for having me. It's been a lot of fun.
The Sniff Spotlight series would like to thank the Renewal Rehab family for sponsoring this program. Renewal Rehab is the best therapy provider for SNFs nationwide. So if you're an owner or an operator of a skilled nursing facility and you want contract therapy, you are going to want to call and connect with Renewal Rehab. This series is geared towards highlighting healthcare leaders as well as healthcare heroes in the SNF space. So thank you all for watching and supporting this program.